Hello and welcome. My name is Sarah Mc Cormack and I'm the National Lead for Healthy Ireland in the HSE, and also the role of supporting staff in adopting healthy behaviours for their health and wellbeing as we deliver that through our Health and Wellbeing division here in the HSE. As you know, today we are joined here to think about our brain, think brain health and look at healthy behaviours to support our brain health. We have an incredible audience joining here, and we said we wanted to look at our incredible brain, and indeed it is an incredible organ that we have here in our body. But I can tell you that we have an incredible audience with over 1,600 registered here for this session today. And that goes to show the interest that there is in there in getting to know more about our brain health. And that audience, I'm delighted to see so many of you from across the HSE and from so many different disciplines, and you're all very welcome. And indeed, we have many of you from other workplaces or local authorities out there. You too are very welcome, and many members from the public as well. So we can see that you want to hear more about your brain health. Of course, I have to say, being Healthy Ireland, it is Healthy Ireland that brings us here today. And Healthy Ireland was launched in 2013. And the whole ethos of Healthy Ireland is about helping our population to adopt healthy behaviours and building a healthy environment so that it makes it easier for all of us to adopt those healthy behaviours. And we have become very familiar with and hearing about our physical health and our mental health and wellbeing. We hear about the risk factors and the evidence that is there about managing those risk factors to improve our health and wellbeing. And those risk factors are so familiar to us in relation to smoking and alcohol, and how we actually manage our mental health and wellbeing, physical activity, and what we eat. And of course, as I say there, we talk about cardiovascular disease, and we talk about 85% of that can be prevented. We talk about respiratory diseases, and 75% of that can be prevented by stopping smoking, by what we eat, and physical activity. But when it comes to our brain health, well, we probably pause and think, what should I be doing? And what do these risk factors actually impact our brain? So I am delighted that you have the opportunity now to hear from a number of healthcare professionals who have developed a great expertise in this area. You also have the opportunity to put your question directly to these experts here today. So all you have to do is put that question into the chat box, and we will be taking those questions as we come to the end of the session. Of course, don't forget about the social media. We want to get up there and we want trending today. So go for it with hashtag in relation to your brain health. And then we do have an email address there for you to actually use as well, which is understandtogether@hse.ie. So now it is my pleasure to introduce to you Dr. Seán O'Dowd. And dementia, and has been clinical lead of the National Dementia Service since October 2022. He has over 15 years experience in the field, completing extensive research in the area of dementia. In 2017, he established a specialist cognitive clinic in Tallaght University Hospital, which is now an integral part of the Regional Specialist Memory Centre. Now, Seán, with all of that expertise, we are delighted to have you here today, and my pleasure to hand over to you to open our session this morning. Thank you, Seán.
And to speak to you this morning about brain health and to introduce the concept. My name is Seán O'Dowd, and I'm a consultant neurologist and clinical lead for the HSE National Dementia Services. So what do we mean by brain health? Is there a definition for this? Well, actually there is. It's been defined by the World Health Organization as the promotion of optimal brain development, cognitive health, and well-being for all across the life course. And in essence, this boils down to taking a person-centred approach relevant to all of us and those that we meet in our workplaces, particularly in the healthcare system, around the principles of preserving brain health, what we have, we hold, protecting it, and preventing our brain from coming to harm. And at a higher level from the policy-making perspective, planning to emphasise the importance of brain health throughout the life cycle. And the concept of brain health has really gained a lot of traction and attention across health services and with policymakers in the last number of years. And this is exemplified, for example, from the European Academy of Neurology's Brain Health Strategy, which was published a couple of years ago. And this revolves around the concept of one brain, one life, one approach. So what is that approach? Well, in essence, it boils down to a number of principles. One is preservation. What we have, we hold. So maintaining our cognitive reserve, and by doing particular activities, good engagement with social activity, with physical activity, and with cognitive activity, preserving our brain health. Then there's the concept of protecting our brain health and preventing harm. And several of these principles will echo those which are given for general physical health and cardiovascular health, such as the avoidance of smoking, excess alcohol, as well as other particular things around sensory deprivation, so identifying and treating visual loss and hearing loss. And then planning from a healthcare perspective and from an educational and social policy perspective about embedding the importance of healthy brains from the earliest phases right through the life cycle. So why is brain health important? Well, I suppose brain health principles are really crucial in terms of reducing our risk of developing dementia. So people will often ask me in clinic, well, doctor, what exactly is dementia? And I suppose it's a general umbrella term describing whereby people have run into difficulty with managing their affairs independently in an everyday setting due to a loss of cognitive skills. Very commonly that relates to memory, but there are other cognitive domains which can be affected that can lead to dementia, such as the ability, for example, to problem solve or make decisions, or language skills. And there are a number of different causes of dementia, Alzheimer's disease being the most common, but there are several other causes. So dementia describes a syndrome or a general term, and there are a number of factors which have been identified as potentially causing and increasing our risk of dementia. And while age is certainly a risk factor for developing dementia, and one that we can't do anything about, dementia is certainly not a part of normal aging and is by no means inevitable. So numerous studies in recent years have identified a large number of modifiable risk factors, largely in middle and later life, which, if addressed, can delay or prevent the onset of dementia. We know in Ireland that there are at least 64,000 people who live with dementia at present, and that's probably an underestimate. And there are maybe 2 to 3 times that in terms of people who are living with mild cognitive impairment, which can often be a forerunner of dementia. And as our population ages and people live longer with more complex diseases and so forth, the number of people with dementia is projected to double over the next 20 years or so. However, evidence shows us that there are 12 potentially modifiable risk factors for dementia, which, if addressed, could reduce the prevalence of this condition by up to 40%. And if we delay the onset of dementia by 5 years, we can halve its prevalence. So at a personal and at a societal level, that has huge positive ramifications. So what are these modifiable factors in life? So in early life, exposure to education is key. When we move into middle life, which is defined as from about the age of 45 to 65, identifying and treating hearing loss can have a very significant impact on reducing the risk of dementia. Other factors in middle life include traumatic brain injury, high blood pressure, hypertension, excess alcohol, and obesity. In later life, defined as over the age of 65, smoking is a very significant risk factor for the development of dementia. So too are mental health issues such as depression, social isolation, and physical inactivity in a sedentary lifestyle is another risk. Air pollution has been noted, particularly in societies where there's high levels of emissions, to be a risk factor for dementia, and diabetes is also another potential risk factor. So as you can see, there are a number of discretionary activities, good and bad, such as exercise, smoking, alcohol, which can impact our brain health. And many of you will recognize that several of these risk factors overlap with those that we associate with other aspects of our health, such as cancer risk or cardiovascular risk of heart disease or stroke. So how does addressing these factors reduce our risk of dementia? Well, in essence, it probably boils down to 2 different sort of pillars, one being maintaining and increasing our cognitive reserve by engaging in lifelong learning and maintaining frequent social contact, as well as treating sensory issues which might interact negatively with our ability to engage socially, such as hearing loss. And then at the level of the cells in our brain, there's probably a mechanism in relation to some of these factors, such as diabetes, smoking, hypertension, high blood pressure, and others which are involved in triggering some of the changes which cause the build-up of toxic proteins and vascular and inflammatory change in our brain at a microscopic level, which over time leads to the problems in our cells which cause cognitive loss and dementia. So in terms of tangible things, I'm just going to illustrate a couple of pointers that have come through from the evidence in terms of reducing our risk of dementia, and we'll speak in a bit more detail with some other members on the panel over the course of the next hour or so. So physical activity. So there's very good evidence that engaging in vigorous physical activity can delay or prevent cognitive impairment and dementia. And in essence, the guideline would be that people should endeavour to engage in physical activity for about 150 minutes per week. I often say to people in clinic, this doesn't mean that you go to train for a half marathon, but just simply taking exercise where you get a little bit out of breath for half an hour can be as simple as a brisk walk. So blood pressure. So we know that in Ireland we have one of the highest rates of blood pressure or hypertension in the developed world. But in fact, very many people in our population don't know that they have high blood pressure. Probably about 50% of people over the age of 50 have high blood pressure. Very many of those don't recognise or know that, particularly men. And there are lifestyle changes that we can make and embrace which will lower our blood pressure, such as exercising, losing weight, reducing alcohol intake, and reducing excess salt in our diet. But it's also really important, if high blood pressure is identified, that medication which is prescribed is taken as prescribed, and really important in terms of our brain health, as blood pressure is an independent risk factor for the development of dementia. And what about smoking? Well, people are very much aware nowadays of the risks that are associated with smoking from the perspective of cancer and heart disease, but people are often surprised to hear that it's also an independent risk factor for the development of dementia. And we know that quitting smoking over time, such as what we see in cancer and heart disease, that people who manage to succeed in doing that get to a level where their risk is similar to those who have not smoked at all. Really, there's a key point, which is that 28-day period. If people succeed in staying off cigarettes for a month, then they're 5 times more likely to stop for good. And lastly, the concept of staying sharp and allowing time for one's restorative sleep and for mental health. So we know that staying connected and a lifelong of learning is really important for our brain health and our cognitive reserve. Taking time out for oneself and taking time for your mental well-being is also a really key component of our brain health. And ensuring that we get a good night's sleep, which is restorative, a time of key importance for memory consolidation and for health in general, not least our brain health. And it's important to recognise that mental health symptoms such as anxiety and low mood should be brought to the attention of the medical professionals if necessary, because they are of themselves independent risk factors for the development of dementia. So in essence then, really the key messages that we'd like to convey relate to certain behaviours that we can modify in our life, such as our diet, maintaining a good exercise regime, and maintaining a good sleep-wake cycle, keeping ourselves stimulated by learning new skills throughout the life course, and managing stress and our mental health in general to protect our brain health. Thank you.
Hello, I'm going to say hello to you again because I understand we had a little bit of a technical problem and some of you there lost connection to the session. So apologies for that. I guess it may be the aftermath of that storm from yesterday. So look, we're back in and good to be back here with you. So I was just finishing off there with the presentation from Dr. Seán O'Dowd, and thank you for that. And Seán definitely has given us a lot of things to think about in relation to our brain health. But as you can see, I'm joined here by some more professionals here working and in this area and has gained a great expertise in this area. So I want to introduce to you the panel that's here with me today. So first of all, I'm coming here to Professor Brian Lawlor. Brian, you're very welcome and thank you for being here. So Brian is a Professor of Old Age Psychiatry at Trinity College, Dublin, and Site Director of Global Health, the Brain Health Institute at Trinity. He is a geriatric psychiatrist with an interest in dementia, late life depression, loneliness and brain health. Brian has worked for over 30 years on developing services and delivering care to people with dementia. His research interests range from early detection and prevention to evaluating new treatments for dementia. So thank you, Brian. And now here to my left, to my right, I'm joined here by Cathy McHale. Cathy works as a registered advanced nurse practitioner in the Institute of Memory and Cognition of Tallaght University Hospital. And Cathy contributes to the research arm of the memory service in that hospital and is part of a clinical trial activity there. She has contributed to national working groups on delirium and frailty and to the development of the memory hut in Tallaght University Hospital and also to the dedicated brain health clinic. Cathy, delighted to have you here with us. And right over here, here on my left, is Catherine Blake. Now, Catherine is a graduate in physiotherapy from UCD and worked as a chartered physiotherapist in the UK, the Australian and the Irish health systems. And Catherine was appointed Dean and Head of the School of Public Health, Physiotherapy and Sports Science at University College Dublin in 2019. And Catherine is qualified clinical researcher and is a strong supporter of research education in UCD and in the Irish Society of Chartered Physiotherapists. And Catherine collaborates widely in the sport and health sectors. So I promised you access to great expertise in this area. So delighted to be joined by this wonderful panel. I will say again and remind you, don't forget to put your questions into the chat and we will be coming back to them. This is your time to get your access to these wonderful professionals that are here. I also remind you in relation to the social media, don't forget to get us trending there, and it is #ThinkBrainHealth. So let's start our discussions. And I think, Brian, I will come to yourself right here. So Brian, you have a lot of experience in this area, and we can see from there in relation to all the different areas that you worked. Heard Seán here talk here this morning, and one thing that I picked up here was about ageing and brain health. Now, we're all growing older. We can't stop that ageing, but you know, is there a decline in our brain due to ageing? Maybe tell us a little bit more about that.
Well, if I just start where Seán left off, I mean, I think that our brain is our most important asset. And I mean, brain health is very close to my heart. And I think it was heard from Seán that what's good for your heart is actually very good for your brain. But there's really no health without brain health. And as we heard from Seán, brain health is really about protecting your brain, getting the most out of it, but also reducing the risks to your brain. We heard a lot about that from Seán. And you really want to do this right across the life course, you know, not just later in life, midlife, but I think we really want to focus on life course brain health, start as early as possible. Now, to your question about, you know, is decline in your brain health inevitable? I would say it's not. As we age physically, you know, we tend to slow down a little bit. Okay, I mean, I can't run as fast as I used to when I was 20. So likewise, you know, with our brain function, there are changes. I prefer to talk about change rather than decline. So with brain aging, there are changes, and there are expected changes. So what can you expect? Well, as the brain ages, there is some degree of shrinkage. The cells decrease in size, particularly in the front part of the brain. So what that means for us on a day-to-day basis is that it may take us longer to think through things. It may take us longer to respond. Our reaction time is slower. Again, just like we can't run as fast, we can't walk as fast, maybe when you're 60 or 70 as when you were 15 or 20. So there is a slowing of the reaction time. But our knowledge base, our understanding, our knowledge and our wisdom actually is even better. So there's an advantage of aging. Our vocabulary remains the same. So there are age-associated changes that map onto brain changes. But these are changes and not necessarily decline. I think it's really, really important to remember that. And there are different trajectories in terms of the speed of change. And this is where I want to get to your second question about what protects. I mean, what can we do to protect our brain as we age? Because this is really, really important. And I wanted to talk a little bit about these superagers. Have you heard of superagers?
Yes, yes.
Okay, the superagers.
The blue zones, is that what we're talking about?
Not just the blue zones. These are people who live to be hundreds.
Yeah.
But there are superagers. There are people who are in their 80s. They perform as well from a cognitive point of view and also from a physical point of view as people in their 40s and 50s. So it's a very, very interesting group of people. And it's a group of people to be studied because we can learn a lot from these superagers in terms of what might protect. And we know that the brains of these superagers, these have very slow trajectory in terms of brain changes and in terms of their cognition. But there's a particular part of the brain in the frontal lobe called the anterior cingulate cortex. It's thicker in these people. But what's most interesting about these individuals is that they seem to be social butterflies. They seem to be very socially connected. So this gives us a clue that there are things that we might be able to do throughout our life course throughout our lifespan that might protect us. Social connection, I know we're going to talk a little bit about that later, but that's one of these protective factors. But again, listening to Seán, I think Seán pointed out a lot of things that we can do to protect our brain, to reduce risk to our brain. And if we do that early on, decline in our brain health is not inevitable. There's the potential to decrease the risk of developing dementia, but decline in your cognition is not inevitable. There are things we can do to protect the brain, to grow a stronger brain, and to slow that trajectory of cognitive aging. So I think it's good news. Good news.
Absolutely, Brian. That's best news. And like we know, we're all an aging population, so it's really, really good. And to maybe get rid of that myth that just because we're getting older, that our brain is actually declining. Now, you mentioned there different things that we do, and I will come back in relation to the social connectivity. But one there that keeps coming up there is about physical activity. So, Catherine, this is an area in relation to that you have a great interest in and research and all of that. And we can see, and we saw great reports there saying physical activity and being active is kind of now described like a miracle drug and a wonder drug. And we talk about this in relation to our physical health and our mental health and well-being. But coming to our brain, what does this actually do in relation to our brain health?
Thanks, Sarah. And I think reflecting back, I suppose, on Seán's presentation there, I suppose looking at those risk factors, physical activity has been, I suppose, shown as, I suppose, a common risk factor for a lot of chronic disease, so cardiovascular disease, for our heart, and also for stroke, and likewise for our brain health. And really it is, I suppose, a wonder drug. And if we could actually bottle it and dispense it, I think one key message to get out today is really that we need to have an adequate dose of physical activity. So it does need to be that 150 minutes per week of moderate activity where you're at least getting a little bit out of breath. So and as Seán said, it's not sort of very demanding, but it is to get yourself moving and to get yourself at least out of breath. There are some people who will take more vigorous activity, and they maybe will then undertake jogging or activities where they're getting their heart rate up and they're getting out of breath and getting sweaty, and then they maybe need a little bit less per week. But I think for most of us it is that thought that it is a dose of 30 minutes 5 times a week, and we see that reflected, I suppose, in a lot of the HSE guidance as well. As we age, we have, I suppose, a decline, as Brian said, I suppose, in some of our body functions in terms of our strength and our coordination and our mobility. But exercise can also help with that. So particularly for adults who are aging, engaging in some kind of strengthening for at least twice a week, and also thinking about activities that improve your coordination, your balance, and that social connection as well. And also if you can combine something that challenges you mentally along with your physical activity, then it's even a better sort of reward for your effort. One other thing to mention, I think, is around sedentary behaviour. So a lot of us have sedentary lifestyles because we sit at our work all day, and thinking about your workplace, so that if you can actually break up the amount of time that you sit in a static position, that's really important as well. So again, thinking about a life course approach to this, thinking about your own context, how can you actually get a little bit less sedentary, and how can you incorporate physical activity into your daily lives? So it could be the walk at lunchtime, meet up with a friend, go and do something, because that social connection is important too. So how does, I suppose, physical activity and exercise work? So maybe just to define those two terms. So physical activity is any movement, but then exercise is purposeful. So it's movement for a particular purpose so that you can actually increase your fitness. So I want us not to be scared of exercise. It is just physical activity to achieve something. And when we exercise, we have an impact on our cardiovascular system. So we improve our heart, we improve the way that we metabolize fats and glucose. So we might touch on diabetes maybe later on, and maybe even obesity. So physical activity and exercise is important in managing those risk factors and in reducing your high blood pressure. I talked a little bit about, I suppose, the coordination as well, and reflecting back on what Brian said, that if we build our reserve, so in other words, if we challenge our brains and our bodies to become, I suppose, more resilient by keeping our coordination, keeping our balance, learning new things, developing new skills and practicing, then that will build both our cognitive reserve and our physical reserve. There is good evidence there. There's good evidence from studies that have tracked people over a long period of time. So we can see that if you have a higher level of physical activity, then there's less risk of cognitive decline and less risk of dementia. And that goes back, I suppose, to some studies that are even showing us that it affects the inflammation in the brain and can help reduce some of those toxic proteins.
Okay, thanks, Catherine. I love the way you brought in there about our sedentary life, because the modern life is making us more and more sedentary. And sometimes we think that because we go to the gym or we go out for a walk, that this is actually doing all the pieces, but we actually forget about what the sedentary lifestyle can actually do for us in relation to that. I love the piece as well, in that just because your age doesn't mean that you actually stop that, bringing that physical activity and that mobility into our lives as well too. So I think there's a lot of there for us to consider, and some of the things that come back, as you actually there talked about in relation to a reference there in relation to diabetes and obesity, whatever. Now, I know that we're giving you a lot of information and we're throwing out a lot of different pieces there about the risk factors. So I just want to remind you that there's a lovely resource out there which is called Know Your Numbers card. And I always say that if you know these numbers and have these numbers, it's better than having the numbers for next Saturday's lotto, I can tell you that. These are the numbers that actually, if you work to them and if you're able to maintain them, that they actually give you the good guidance in relation to maintaining that healthy lifestyle. And that is available to everybody, free and available in any numbers that you want, and it's available on healthpromotion.ie. So that's one that I would actually encourage you all to actually take and have a look at. Now, I'm going back to Seán. Seán, I picked up there in your presentation that you mentioned sleep. And I have to say, sleep is something that has really, I suppose, come to my attention more recently over the last few years. And I hear more and more about sleep and quality of sleep and number of hours of sleep and whatever. What's this link between sleep and our brain health?
Yes, so sleep, I think, is, as you say, it's something that has probably gained a bit more attention in recent years with the advent of, iWatches and so on and so forth, and sleep trackers. But I think it's something that probably has been neglected in terms of our health for generations now as life has gotten busier. And it is really, if you could think about the proportion of your life that you spend asleep, it's a really important aspect of our lives. And I guess, I was thinking about, sometimes when I speak about sleep in talking to medical students and so on, we know, humankind has known about the importance of sleep for generations. If you think back to Shakespeare's Macbeth, there's a beautiful soliloquy about the importance of sleep, where he talks about it knits the ravelled sleeve of care, sore labour's bath, the balm of hurt minds. And I think that really sums it up, and the importance of sleep. But it can be a frustrating thing when people struggle to sleep. And it's important from a brain health perspective for lots of reasons, not least, I suppose, because there is evidence that during sleep is a time when we have memory consolidation, but also that, as Catherine referenced about, we know that there's toxic protein aggregation, particularly in Alzheimer's disease, but in several of the other dementias, and that those proteins there's evidence showing, are cleared more effectively by a particular system in our bodies and our brains when we're asleep. So if sleep is fragmented and broken up, we're at a higher risk of developing brain health issues and cognitive impairment. And therefore, it's really important, I suppose, to be mindful of that. So there are, lots of very good resources there in terms of sleep hygiene, which, relate to reducing caffeinated drinks coming up to the evening hours, and, screens, which are sort of the bane, really, of our pineal gland. So, the screens like our iPhones and our tablets and so on, emit a particular light frequency that affects our pineal gland in our brain, which is involved in our circadian rhythm, our sleep-wake cycle, and the secretion of melatonin. So there's a lot of very good information out there, including in HSE websites, about protecting sleep. And then there are things which will fragment our sleep quality, which we need to be conscious of and to recognise and seek treatment for if they're part of our sleep experience. For example, sleep apnea. Again, coming back to some of the recurrent themes, like relation to maintaining a healthy weight. If we slip into overweight and obesity, the risk of sleep apnea is higher. Sleep apnea is very harmful to our sleep quality and leads to a lot of sleep fragmentation. And bad nights make for bad days, and bad days make for bad weeks, and so on. In terms of people's cognitive well-being and brain health, there's a lot of work showing that identifying these sleep disturbances is really important. And I suppose the crutch that sometimes people will often resort to is the infamous night cap and alcohol. And I guess, while there is, evidence that very good evidence that excess alcohol is harmful to our brain health. There's also some evidence about even moderate drinking before bedtime is not a good idea. So we say, okay, have a glass of wine, but have it maybe 3 or 4 hours before bedtime, have it with a meal, because sleep is very disturbed by alcohol, and it causes a kind of maybe a greater, quicker onset of sleep, but then there's a rebound later in the night in terms of nightful waking during the night. It disturbs the quality of our dream sleep, REM sleep, which again is that really key component of our sleep cycle for memory formation and consolidation. So the nightcap, maybe not such a good idea. And in general, sticking to the guidelines about moderate alcohol intake is really key for brain health.
That's great, Seán. And I can remind you that there's great information out there on askaboutalcohol.ie, which will actually follow on there from what Seán has said and tell us in relation to guidelines and different drinking. And also from sleep and other areas, there's a great amount of information on yourmentalhealth.ie, which is available there to all of the public and to all of our staff as members of the public. And in there is a great source of information that's there, and that also covers good guidelines in relation to sleep. So we certainly have certain definite things to take about sleep, and that's certainly one that I can take in a take-home message from here, not about the alcohol, but about the working late and about not getting to bed in relation to it. So I'm going to go back to you, Brian, now, because one thing that's really interesting to me is about social connectivity, and you mentioned social connectivity in relation to that. And I suppose sometimes they say you never miss the water until the well runs dry. And I think social connectivity really came to the fore during COVID. And we really thought about what we actually missed in this. But social connectivity and what we're talking about today, brain health, how does all this tie up together?
Yeah, well, connection, I think is really, really important for your brain health. I mean, as a psychiatrist, we always say that isolation harms and connection heals. And I think social connection really is the foundation of health, really. And I think we see all this in COVID, as you mentioned. I mean, I think that the impact that isolation and loneliness had on the well-being of people, and this is right across all age groups, not just older people, but younger people, particularly younger people, actually, in terms of the level of loneliness that they experienced and the impact that had on their quality of life. And we know that during COVID, that particularly for people living with dementia, the isolation and the loneliness caused significant deterioration in their cognition. But also for younger people during lockdown, we know from studies that when their cognition was assessed remotely, you could see that the isolation and loneliness during lockdown was impacting on everybody's cognition, and then it reverted to normal when the restrictions were lifted. So isolation and loneliness has huge impacts on your brain health, on your cognitive health, also impacts on your mental health, a major risk factor for depression. And when I was in medical school, we learned very little about the impact of social connection or loneliness, isolation on health. And now, of course, we know that, as I say, it's a foundation. It has major impacts on physical health, mental health, but also cognitive and brain health. So the flip side of isolation and loneliness, of course, is the social connection, and really it's very, very good for your brain health. And we know that if people are socially connected, it tends to build what Seán and Cathy referred to as this cognitive reserve. So your brain becomes more flexible, more resilient. So that over time and over a lifetime, you're better able to deal with the wear and tear of the aging process. And when pathology sets in, you're able to circumvent it. And as I say, your brain is more resilient. So social connection is powerful in that regard, and really, really is something that we should be prescribing. You talked about exercise, prescribing exercise. We also should be prescribing social connection as much as possible, because it is as powerful as any drug. And we know also on the negative side that people who are more isolated, not socially engaged, and are lonely, they're more at risk of developing dementia. And again, this is why I feel very strongly about we need to intervene not just later in life, but at midlife. But really, loneliness is an issue right across the life course, particularly for younger people. And we need to address loneliness and isolation and build social connection from a very, very early stage, because it will grow a stronger brain. And it's really important. So it's not just a message for older people. We have the stereotype of social connection being important for older people. But social connection is hugely important, more important, I think, for younger people. And we need to emphasise that as part of, I think, of Healthy Ireland going forward and having healthy brains.
And I absolutely think of that because so much in relation to our younger people, we're constantly looking at, it's all about the social connection, but it's the social connection to the technology perspective. And it's really about how do we get our younger people out into that person and interaction. But I'm just going to come to you now, Cathy, because I'm just moving more across, maybe more to the older person or as we age, because something I picked up there in the presentation and looking at the risks there in relation to dementia was about hearing and hearing loss. So maybe, Cathy, you're seeing the patients there in the clinic and something you're familiar with. Just maybe talk to us and share a bit about what hearing and hearing loss and what that can actually mean in what we're talking about here today about brain health.
Sure. So hearing loss, I suppose it's been on our radar for many years, and there was a body of literature suggesting a link between hearing loss and dementia. So it wouldn't have been an unusual concept necessarily. But when the Lancet paper came out and the report came out, it was just surprising to see the amount, 8% modifiable risk factor, so the largest modifiable risk factor, but for those patients who had unaddressed hearing loss in midlife. So that was sort of a different element for us, really. You know, patients who are 45, 55, they don't necessarily have that on their radar, really, and they're quite surprised when that is the case. So I suppose we see hearing loss, it can masquerade as cognitive impairment a lot because, you know, patients will lose high-pitched hearing ability and they will lose potentially the ends of words a lot of the time, and they'll misinterpret what a word means and they'll lose the concept of the conversation. So we'll hear families coming in saying, you know, he doesn't follow what I'm saying, he doesn't, you know, his memory is very poor, or he doesn't remember the flow of the day, but actually it's more of a hearing piece. So that certainly is the case. So there's, you know, it wasn't an unusual connection. I suppose there's three schools of thought. First school of thought would be around that whole concept of cognitive load. So, you know, if you have hearing loss, your brain is going to be working harder to account for that, you know, so our hearing can be intact, our ears can be working very well, but it requires our brain, you know, to make sense of that information, to decode it, and to give that slick message. So in hearing loss, you're getting garbled sounds going to the brain. So, you know, that therefore leaves less reserve cognitively for things like memory formation, you know, attentional issues, you know, any of the cognitive domains, really. Second school of thought, I suppose, around the structural piece. So if your brain isn't using those areas that are responsible for speech and sound, then therefore those areas can potentially atrophy if they're not being used. So that's another element. And I suppose certainly with patients who have hearing loss, and when we look at them in clinical studies and we MRI their brains, we can see atrophy or shrinkage in those areas of the brain that are responsible for memory. So hippocampal area of the brain. So there certainly is that connection. That temporal lobe is really important for auditory processing, but it's also something that we'll see, particularly in Alzheimer's dementia. We will see shrinkage in that temporal lobe area of the brain. So there's that link. I think the last one ties very nicely into what Brian and everyone said, really, around that social connectedness piece. So, you know, if you have a hearing impairment, you are therefore going to be socially withdrawn, really. You are going to be disconnected. And so there certainly is that link. And I suppose hearing loss, you know, two offshoots of that would be depression, which in itself is an independent risk factor. It was on Seán's diagram from the Lancet report, but also that whole sense of the person just being, you know, just very isolated and withdrawn. And so, you know, they're kind of complex interplay factors between the two. Yeah.
And you can see more, as I would call it, the younger people actually maybe in relation to having the hearing loss than we might be more familiar with. But like, have we it built in enough in relation to our clinical pathways about how we actually identify hearing loss? You know, from your, maybe just share with us something about how you identify that. And
yeah, it's on our radar all the time. We would do basic screening. We try and take comprehensive history from patients and from families. It's very important to take a history from family because they're going to be observing, you know, heedlessness, lack of attention. You know, so I suppose we do basic screening. We use Hear Check, so that's a device that you can use. There's various devices. We also link into an audiologist in the Brain Health Service in Tallaght, senior audiologist Jennifer Sharkey, who knows everything there is to know about hearing and is phenomenal. but it is, there's a pathway through to primary care centres for screening, and there's a drop-down menu on the HSE website, so people can go in and see where they're entitled to go. If you have a hearing aid, you're entitled to free, or if you have a medical card, you're entitled to free hearing aids. If you don't, you can be eligible for PRSI, contributory payment benefits. So you can actually get €500 towards each hearing aid. So I think 1,000 in total. And also the Department of Social Protection has a facilitated grant for patients who, if they need hearing aid repairs. So there is certainly a structure there in the background. Do we think about it when people are 45? Potentially not. I don't know. It's certainly on our radar in memory services, particularly in brain health services. But, perhaps things like this will move us towards considering it in patients who are coming through.
And you would say hearing aids are important?
They are very important. It was a very topical paper recently retracted in the Lancet Public Health, whereby there was a link made between hearing aids and all-cause dementia. That's since been quashed, but really it has raised the profile of this conversation really about hearing aids. So there's certainly, we have evidence to suggest that they can be quite good in, reducing that incline of cognitive impairment, potentially slowing it down. And also, I suppose, what the research has shown us that in certain groups of patients, particularly high-risk cardiology patients, across long cohort studies, they do very well with hearing aids, up to 50% reduction in cognitive decline. So there's just such a benefit, and of course, it infers no medical risk really. So we should be thinking about it, if only just to decrease the social isolation that Brian so eloquently laid out, and reduce that loneliness factor, reducing that sense that the patient is disconnected from the world, which has a knock-on effect on their confidence. It really increases anxiety when people cannot hear. And you're also, I think hearing aids are for family as well, so it's very tiring to support someone across the day. So, I think there's no reason not to use them. And certainly Alzheimer's international report from last year would have had it as one of its recommendations that we really should be thinking towards hearing aids and treating hearing loss, because it's very transferable, it's cost effective, so it's certainly on our radar.
Okay. Yeah. So I'm just going to remind our audience now about the questions. Don't forget to put your questions in there in the chat, because we'll be coming to them very soon in relation to that. But just before we go to the questions, I want to ask you there, Cathy, because you're there in the dedicated brain health clinic and you're seeing the referrals there day in, day out. What might be one or two top interventions that you can see that has the greatest impact there for the patients that you actually see?
I suppose one of the ones that springs to mind is the XWell medical exercise programme, linking very much into what everybody has said, but particularly what Catherine has outlined. And I think that is, it's a community-based programme whereby the patient can have an online access and also face-to-face access to exercise classes. It's life-changing, really. I mean, I've seen, huge impact, and it's a sort of multimodal intervention. We know from the finger studies that if you come at these risk factors from certain angles, from more than one angle, there's a better contributory factor at the end of that. And so I think in terms of well-being, in terms of reducing depression, in terms of connecting people in socially where they have their cup of coffee, it's really important. And of course, it's a life-changing piece that will last for many years, hopefully, for our patients. The other one, I suppose, quit.ie would be really, really important. And I know you've outlined the smoking piece, but I mean, we really cannot get away from trying to get patients to make those lifestyle changes, particularly in the area of dementia where the risk is so high. So I think the beauty of that programme as well is that the person does not have to be ready to do this, to make this change. So I think when we talk about making every contact count, of course, we're ready to say this is when you need to make this change, but sometimes the patient isn't quite ready. So it's a really important message just that people can ring this helpline, they can talk to an advisor, but they can make a plan to sometime in the future stop smoking. So we found that a really beneficial intervention. I think anything that's tailored, that's individualized towards the person is going to be more impactful, and something whereby you are facilitating them and you're giving them assistance with pitfalls. For example, in smoking, people fear putting on weight, so built into that program is a whole section whereby the patient will be supported with that piece. So yeah, anything that is facilitated across time, I think works really well.
And I think there's great messages in that as well for our staff, and we're constantly trying to promote and support our staff in relation to quit smoking as well. And at that stage, I'll refer to a lovely handbook with their brochure, which is actually for staff health and wellbeing and helping our staff to adopt healthy behaviours. And that is available there to all staff and available free there on healthpromotion.ie. And it covers all of the areas that we're talking about: alcohol, physical activity, mental health and wellbeing, smoking and those. So I encourage you, if you haven't already got it, get your hands on it. So now we're going to come to your questions, the questions from the audience. And I'm delighted to be joined here by Paul Maloney, the Programme Manager for the National Dementia Service. And Paul, you have been busy here this morning looking at the questions coming in from our audience. So thank you very much, Paul, for giving your time and joining us. Delighted to have you. And Paul, really interested in hearing the questions from the audience. So over to you.
Thanks, Sarah. Lots and lots of questions, lots of engagement, which is fantastic to see. I think a lot of the questions have been answered through the Q&A, which is great, but there's a couple I've pulled out. The first question here I'm going to direct towards Brian. I see that depression is a risk factor for dementia. My uncle developed late life depression a few years before being diagnosed with Lewy body dementia, and the specialist said that depression can be an early manifestation of the disease itself. And is this true?
So that's a really interesting question and a very important observation. So this bi-directional relationship between depression and cognitive decline. So we know that depression, over the life course is an independent risk factor for the development of dementia later in life. But I think what's happening in the situation as described there is that the occurrence of depression was a prodromal feature of the dementia. So what can happen is that brain changes, deposition of these toxic proteins, can result in the development of depression or anxiety or even loneliness. So that can be a manifestation of brain changes. So depression can be a manifestation of brain changes. But it's also important to note that over the life course, the occurrence of major depression is an independent risk factor. So it can cut both ways.
Fantastic. Thanks very much, Brian. We have another question, and this one I might get Catherine to answer this one. This is in relation to a partner of somebody who's online. So my partner works in a very sedentary job. He's not overweight, but takes no exercise. He is 55. He says it's too late for him to take up anything now. He's generally healthy, but he has a family history of dementia. How can I encourage him to get active?
Yeah, so I think, I suppose changing behaviour for anybody is quite difficult. And I think it is really about just taking things step by step. And I suppose like quitting smoking or anything like that, you have to have the intent that you're going to do something. So I suppose encouragement from family is really great. And I'm glad to see the question coming in. But it is, steps. So I think, walking for 30 minutes a day is quite achievable. Or building bits of physical activity into your daily life. You take the stairs, so making those kind of active choices to become more active, and it will accumulate. 30 minutes sounds quite a long time, but if you could break it down even into 10-minute chunks, so that you go for a 10-minute brisk walk and you try and build that up then to eventually getting on to 30 minutes a day. The sedentary issue there, I think, is something really worth us all thinking about. So actually breaking up that sitting time, because it is an independent risk factor for our cardiovascular disease. So it's good for our hearts, it's good for our brains as well to get up and move. So to take that lunch break, to take the coffee break, to get up and move and not to stick at the desk. And maybe while I'm talking about that as well, I just might mention the diet, because I know we possibly will get some questions in around that. So when we're thinking about physical activity, it's about the energy we expend. And when we're thinking about our diet, it is the energy that we're eating. And there's a lot out there, I think, in the media about what is a healthy diet and what isn't a healthy diet. So what we could say is really that the Mediterranean diet, which is high in fruit and vegetables, seeds, nuts, olive oil, whole grains and things like pulses and beans, but low in animal fat, saturated fat, will keep your cholesterol down, it'll keep your vascular health better, and it also has a protective effect for your brain.
Thanks very much, Catherine.
And Paul, could I just come in? For that person with the 55-year-old male partner, have their blood pressure checked.
Good advice there. Leading on to that question around the diet, there's another question here. It seems like obesity and poor diet increases your risk of lots of diseases, and today I've learned that it is also a risk factor for dementia. Should there be more of a focus on the importance of nutrition in schools? So I think that could be answered by either Catherine or Sarah or Cathy, really.
I know the life skills program is very prevalent in Ireland at the moment. It's very prominent. My children have gone through it, and they are certainly, that is on their radar. They're really aware of much more aware than I think I would have been about dietary issues that support brain health, and they're very aware of smoking risks, and they're just more aware of those modifiable risk factors. But I think definitely we should be starting as early as possible to get this messaging out there, and to really ingrain those messages, because we're trying to make changes early in life.
And good parenting is really, so important at home in the parenting. And there's great resources there on the HSE website as well too. And even for our homes, and what we're actually looking at there, I'll recommend to you there's 101 square meals freely available on healthpromotion.ie. There's enough of recipes in that for any of us, and give us the good guidance on that as well. And just that you were mentioning physical activity before that, there's also a great suite of online free available yoga, Pilates and strength building classes. Just go to our HSE Health and Wellbeing YouTube channel and you'll get access to all of that. So as I sometimes say, we have plenty of resources, but probably it's the challenge. We've got to get using those resources and build them into our lifestyle. How are we going for one more question? Yep, we're doing okay.
Brian is going to come in there.
Brian, sorry, Brian.
No,
yes, Brian, of course.
On the issue of inequities, and I think that obviously for people with HSE, they can access resources, but I think one of the things about brain health is that the people who can most benefit from a brain health approach sometimes may not be able to access. So I think access to services, to health, to resources. I mean, I think food, for example, and diet. I mean, and gyms, for example. We need to look at that so that everybody has access to the opportunity to improve their brain health. And I think this is going to be a big focus, I think, as we move forward in terms of how we address brain health across the life course, looking at those who are less fortunate or vulnerable, and maybe we need to do more for those people who have inequities and are vulnerable. Everybody needs to get the message, but we need to also focus on those vulnerable populations, those people who are poor, who don't have access to services or to those resources. And they need the information, but also I think we need to look at preparing the community so that we can activate their brain health approach as well.
Yeah. Because we can definitely see it always in the statistics there, the people that are living in the lower social economic groups, that there's always those higher instances in relation to those risk factors, the update of them, and then the impact back in relation to our health. Well, shall we have time to take another question?
There's one more good,
Paul?
really interesting question that's come in there, and I might direct it to Seán. The question is, how much does genetics play in the role of dementia?
Yeah, so I suppose there are, as we said, lots of different reasons why and causes of dementia, the most common being Alzheimer's disease. And, I guess because dementia is associated with all of these things that we've talked about and with aging itself, that there are lots of different genetic influences that can potentially increase our risk of dementia. But dementia is very common. If you take the population over the age of 50, about 25% of people will have a first degree relative with dementia. So in terms of a single gene risk, it's actually extremely rare to have that sort of generation to generation one gene causing a problem such as Alzheimer's disease. That's less than 1% of people with Alzheimer's disease. But our genes influence everything about how we're made up in terms of our vascular health, in terms of our physical health, in terms of our mental health. So there's no doubt that there's a group of people who, through no fault of their own, they're probably genetically at a slightly higher risk because of these polygenic influences. And I suppose that's a group where, like that, there's been a lot of work done in Scotland in terms of brain health, identifying those throughout the life cycle. So knowing early in your life, well, I have these genes which, mightn't be a named gene per se, but I have a family history which might make me a bit more vulnerable from a brain health perspective, and addressing these modifiable things throughout the life course in terms of, engaging in a lifelong of learning, of social activity, of physical activity, and minding our kind of vascular health.
Thanks very much, Seán.
I'm just going to amplify and add to what Seán is saying. I mean, just because you have a genetic susceptibility doesn't mean you're going to develop dementia. And I think this is the message today is about there are risk factors, but there are many protective factors. So even if you have a family history of dementia and there's a risk, and age is a risk as well, there are many things that you can do to protect your brain. And we've talked a lot about these protective factors and modifying your lifestyle. And so I think it's a positive message that even with the genetic risk and the susceptibility factor, you can still, I think, decrease your risk, reduce the risk to your brain, and improve your brain health.
I love that in relation to the protective. You said there the protective factors, and that's what we're about, protection and prevention in relation to that. So I think we probably need to leave the questions there from the audience. Thank you from the audience. There were great questions and definitely great information in them. So we are beginning now to come to the end, but I'm not going to let my panelists go without actually. I love always a take-home message. So I'm just going to spin around here and ask all of you for one take-home message from today's session. And Brian, I'm going to come to you first.
Okay. Well, as I said before, I think our brain is our biggest asset. I think, and we've talked about this today, our brains are plastic. I don't mean plastic, I mean we have plasticity, and that means that they're capable of adaptation, modification, and repair, and we've heard a lot about this. So we can grow connections in our brains, we can build connections between our neurons right across our life course, not just as a kid, but as a younger person, an adolescent, in midlife, and even in later life. You still have brain plasticity. Yeah, you can grow your brain through stimulation, education, exercise, and of course, social connection.
Thank you, Brian. Thank you. And Cathy, I'll come to you next. Take home message from you.
Mine's going to flow nicely from yours, Brian, actually. So just around that neuroplasticity piece, I suppose, just a message for people regarding hearing aids. Hearing aids should be worn every waking hour. And one of the issues we have is compliance with using them. So it's just important for staff to make sure they're putting them in, first thing in the morning, and that they're keeping them in all day. What patients tend to do is, Sunday brunch on, kids come over and they pop the hearing aid in and they use it once a week. But it is very much the case that you have to stimulate that auditory pathway and you have that neuroplasticity. Otherwise, they don't work. It's like breaking in a new pair of shoes, so that's a really important piece. I've had a penny for the amount of patients that sit in front of me. I think I had 2 in the last few weeks, and they say, they don't work. The hearing aids didn't work. And that's part of the reason. The other thing, just very simply, checking that batteries are working, checking that there's no earwax blocking them, and just making sure that they're in, and also if you have a patient who is hearing impaired and they seem to be more hearing impaired than they should be having working hearing aids that are making that better. If they're not, don't just assume because they're hearing impaired that's okay. You have to check with the person that they can actually hear you. I think they're just important pieces. We need to also prevent delirium, and that's one of our biggest sort of enemies in the dementia realm. So hearing impairment is a significant risk factor. So enhancing that sensory awareness is extremely important. So that would be my blurb.
Cathy. Thank you, Cathy. And Catherine, take-home message from yourself.
Yeah, so I suppose my message really is that kind of exercise, you need to think about it a bit like, the drug. So you need your daily dose, and that I think that's achievable for everybody. So no matter what age you are or where you're starting from, that you can actually increase your physical activity, and it will be beneficial. It'll be beneficial for your heart health, it'll be beneficial for your brain health. And also, if you practice, developing your coordination, if you include I suppose new learning, take up dancing, something like that. It's going to stimulate your brain as well, and it will tap into that making of new connections. So I suppose the daily dose and to pick up something that you interact with people and that it will be fun.
Lovely, Catherine. And then Seán, I'll come to yourself for a take-home message and maybe just a final few words here before I just close out our session here today.
Yeah, I suppose just to touch on these modifiable risk factors, several of them have a lot of overlap with our vascular health. So love your heart. It's a kind of an easy thing to remember. So be conscious of the risk of high blood pressure, particularly as we get into middle life. Be conscious of weight, be conscious of smoking, alcohol excess. All of the things that we know can be harmful to our vascular and cardiac health can also be harmful to our brain health. So identifying them and treating them.
Okay, thank you, Seán. I certainly have enjoyed your input here today. Not just enjoyed it, but I've certainly learned a lot in relation to brain health, and I hope we can all benefit and take that with it. So I will close out our session and thank our audience for joining again. I apologise for anyone who did experience that technical breakdown that we did have earlier with it. I thank you, the panellists, for giving of your time here. Thank our audience, and I want to particularly thank Fiona Foley, who is the Senior Project Manager with the Understand Together campaign, because Fiona worked very closely with me in supporting and getting this session here today. I thank all my great support here, our technical team, and my own Healthy Ireland people that are here. It's that team that brings it all together. We want to hear more from you, so please do send us any suggestions that you have for running more of those sessions. If we are getting a registration here of 160 people here, it's not 160, it's 1,600 here today in relation to it. There is a great need in this subject, so please do tell us of other areas that you want to hear from, and we will actually follow that and put it in. So as I sign off to you today, Sarah McCormack from Healthy Ireland and HSE Health and Wellbeing, I will actually take up what I've heard here from those guys here, and it simply says, love your heart, stay smart, and keep connected. So thank you very much. Slán go fóill agus gur míle maith agaibh.